Oh, hey guys, thanks for stopping by. I'd ask how you're doing, but lately it feels like there's not really a good answer to that question. Actually, while I was catching up with some friends just the other day, I realized I've been feeling pretty under the weather lately. Don't worry, no fever, and I've been social distancing, I promise. I've just been feeling a little worn out and maybe a little lonely too. As much as I love video chatting with my friends, it's just not the same as connecting with them in person, you know? And on top of that, life just feels so scary and uncertain right now. Thinking about what's going to happen in the future just makes me so stressed sometimes. So it got me thinking, if I'm feeling this way, I wonder how other people, like frontline workers, are doing. Now, what you may not know about me is that I'm a scientist, or at least a scientist in training. So to answer this question, I decided to hit the books and find some answers. Want to know what I found out? Let's head over to my favorite chalkboard. First up in my findings, an idea you might have heard floating around lately that describes how this pandemic is binding us all together in a way. This concept is called collective trauma. Collective trauma is the psychological effect of a tragedy that's shared by members of a community or a society. Right now, there are a lot of people who are overwhelmed by the impact of this virus, in addition to feeling isolated because of the social distancing measures we have to take. The pandemic has changed the way we work and the way we connect with each other. While a collective trauma can highlight our interconnectedness, it can also do the opposite, with the competition for resources and care leading to damaged bonds between subsets of society. This idea that social support systems might disintegrate in the face of collective trauma is especially worrying in more individualistic societies, like the one we have here in Canada. It's scary to think about how seriously this pandemic might be affecting us, but at least we're all in this together, right? Well, not exactly. See, when it comes to the mental health effects of this crisis, the long-term impacts are going to be different depending on things like who you are, where you live, how much your income is. There's a lot to think about, but there are a few factors that are especially important. People with lower income and lower levels of education, along with people in unskilled and semi-skilled occupations, which includes a lot of people who are playing crucial roles as frontline workers right now, more commonly report low self-rated mental health. People with lower income and lower levels of education also have a higher rate of mental illness-related hospitalizations and suicide mortality. In areas with a high concentration of Indigenous people, mental illness hospitalization rates and suicide mortality rates have been found to be 2 to 3 times higher than areas with lower proportions of Indigenous people. When it comes to thinking about mental health, it's important to make sure we're looking at the whole picture. See, the effects of health disparities, which are preventable health differences between groups of people, aren't just a one-time thing. These issues affect people throughout their lives. Indigenous and Black Canadians have been found to be more vulnerable to risk factors related to chronic diseases, like hypertension or obesity. How does this vulnerability happen? The short answer is racism. But the longer explanation is that racism limits access to health resources, in addition to the mental and physical toll that it takes on the person experiencing racism. Reported discrimination is significantly higher among Black and Indigenous Canadians. And experiencing discrimination on a regular basis has been linked to a doubled risk of having a chronic condition. These disparities have been linked to the multiple levels of racism that members of visible minority communities may face, from interpersonal racism to structural racism, as well as historical and contemporary colonial trauma at the broader societal level. In a recent interview with Slate.com, Dr. Uche Blackstock, a Harvard-educated physician as well as the CEO and founder of Advancing Health Equity, explained how interpersonal and structural racism work together to create vulnerabilities. The weathering effect is when everyday racism causes a stress response that ages our bodies, and epigenetics is how structural racism and that chronic stress affects gene expression. There are so many factors at play when it comes to racial and ethnic health disparities, and the consequences often reach across generations. The kinds of chronic conditions that visible minority communities experience at a higher rate also happen to make people more likely to have worse outcomes or serious complications if they do get infected with COVID 19. And on top of that, the historical racism that these communities have experienced when dealing with healthcare institutions can make seeking medical care challenging. So many of us are relying on healthcare services to take care of us and our loved ones. But if you can't completely trust these institutions, accessing these services becomes much harder. As you can see, there are obstacles that Indigenous and Black communities uniquely face when it comes to their health. And it's not just these communities that are being impacted. Frontline workers, migrants and refugees, people experiencing abusive relationships, there are a lot of people who are vulnerable during this crisis, partly because of the health inequities that are affecting them on an even greater level than usual. It's these inequities that explain the headlines you may have seen lately about how COVID-19 is affecting marginalized communities in Canada and the US. While we don't yet have concrete data because of the lack of race-based data collection in Canada, we know from reporting in the US that Black communities are being disproportionately impacted by this virus, as shown by the higher mortality rate among these groups. Areas associated with lower socioeconomic status have been tied to higher rates of illness, which you can see in this map of the relative impact of COVID-19 in different neighborhoods of Montreal. Meanwhile, researchers at the University of Toronto are trying to help educate healthcare workers about barriers to accessibility for LGBTQ Canadians. Like Black and Indigenous Canadians, sexual and gender minority individuals have been suggested to be at a higher risk for the kinds of chronic illnesses that can make them more vulnerable to COVID-19. There are also high infection and mortality rates, specifically among healthcare workers from ethnic minorities. And since globally 70% of frontline healthcare providers are women, women of color may be especially at risk of infection. In Canada, Indigenous women, racialized women, newcomers, and women with disabilities are among those expected to be hit the hardest by this pandemic because of their intersecting, marginalized identities. We still don't have all the answers when it comes to why we see these disparities, but we do know that experiencing them can take a toll on physical and mental health. The psychological burden of either being infected or fearing that it's only a matter of time until you're infected can be overwhelming. We're all experiencing a collective trauma in the form of this pandemic. But the multiple incidences of racism due to misinformation about the virus, as well as incidences of racially motivated violence against people of color, mean that people who belong to these marginalized communities may be experiencing multiple collective traumas. We started out by talking about collective trauma, and the truth is that this does affect all of us to some extent. So how do we deal with this? It starts with creating an environment where people feel safe to share their experiences of loss and post-trauma symptoms in the aftermath of the traumatic event. This idea of a community might look a little different right now, but community building that happens online can still help with processing and coping with these experiences. Seeking to understand the diversity of people's experiences with this pandemic and validating the immense sense of loss that so many are feeling right now can help us to heal together. One of the ways we can find meaning in this time of crisis is by allowing our memories of this trauma to contribute to a stronger collective identity, whether that's on a community level or a national level. How do we create this kind of collective identity? Well, a big part of it involves creating a transgenerational collective self. In other words, making sure we pass down the lessons we learned from this pandemic to the next generations to create continuity between past and present, and to help future generations see the value of a group or community identity that encourages us to contribute to the greater good. By passing down these ideals, our collective society can mobilize against the factors that led to this crisis or made it worse. Taking the time to learn about the challenges some people face when they're trying to get the care they deserve is a big step. We've done a lot of learning today, so thanks for sticking with me. You might be thinking, it's unfair that this is happening, but what can I do about it? Well, lucky for you, I happen to have a few ideas. If you're interested in learning more about how health inequities are being amplified by COVID-19, The National Collaborating Center for Determinants of Health started a conversation series on April 1st titled Health Equity, Determinants of Health, and COVID-19. You can watch the first webinar in the series by following the link in the description. If you're looking to do something more hands-on, look for volunteer opportunities at places like your local food bank. You can look up Volunteer Canada or follow the link in the description to find COVID-19 related volunteer opportunities in your area. You can also contribute to your community by donating to campaigns like the Frontline Fund, which is representing all Canadian hospital foundations, or Food Banks Canada's I8 campaign. But most of all, take the time to check in with the people around you and ask them for their perspective. Thank the essential workers you encounter and treat them with a little extra kindness. It's more important than ever to do your part and be a good neighbor. You never know how much you can affect someone just by taking the time to reach out. And the more we hear each other's stories, the more we can understand the best ways to look out for each other. Well, that's it for me. So if you'll excuse me, I gotta get back to the lab. Just kidding, I'm just going back to my socially distant lab, also known as my house. Take care, everyone.